Welcome to Jiu-Jitsu for Physical Therapy. I am Instructor Jesse, and I'm going to show you in these series of videos how to use the principles and techniques of Jiu-Jitsu to help your patients and improve outcomes. Okay, we're back on our next bridging video. This bridging video is going to be more complex bridges, focusing on some fall recovery techniques. So we're going to work on bridging, having the patient bridge over their shoulder, looking and reaching, as well as bridging all the way over to their knees, which will put them in a quadruped position. And then we can start managing how to get up off the floor. In example, if they were to fall and have to try to get up to a phone. Okay, we're back. We're seeing some bridge to shoulder motions I like to have patients do. Notice that Ryan takes his head offline. He does lateral flexion and then rotates his head in the direction he's going to roll. And it leaves a small space between his side of his head and his shoulder. And you can see right there, there's a little bit of air space under there. Both lower extremities stay on the mat. This is the same as the double leg bridge we saw earlier. When the patient gets to the top of their hip extension, you simply have them activate their obliques and start reaching. Once again, this is pretty safe and doesn't require a lot of guarding, especially if they're just laying on a mat. As you see here, Ryan is now bridging to his knees. The lateral flexion and rotation of the cervical spine still apply. When the patient begins to reach, they will simply step over with their top leg. You will be guarding a little more in this exercise, and you will be assisting sometimes with this hip turnover right here. It usually helps to put a knee on the mat, keep your body mechanics good while you're doing this. This will be used for fall recovery. Not exactly as dynamic as this, but that basic motion of turning over to your stomach from your back is going to be very, very important. And the activity you see right here after the bridge to quadruped, he does a sit out where you post your hand and feet to turn back over. So these are the basic foundations of fall recovery and core stability activities that I use. It also is going to build endurance with the patient. And like I said before, separate their breathing from their abdominal contractions and hip and core musculature. Okay.